Friends, welcome to my workplace at Ranaghat, West Bengal, India. Let us see management of a hard nucleus. This is a cataract with grade 4 nuclear sclerosis, maybe grade 5. And now we have started this surgery. This is the main incision with a 2.8 millimeter steel keratome. And now I make a side port on the left side of the main wound about 3 clock hours away. And now the anterior chamber is filled up with an air bubble. Underneath this air bubble, trypan blue dye is applied to stain the anterior capsule. When we use air bubble, staining is very quick. Within 10 to 15 seconds, the anterior capsule is nicely stained. The dye is washed out. Excess dye is nicely washed out with 23G Simcoe cannula, and now the anterior chamber is filled up with 2% hydroxypropyl methyl cellulose. Methyl cellulose is applied over the cornea for better visibility, and now I am going to do capsulorhexis, and I use a Utrata forceps. The capsular tag is raised. This capsular tag is guided all around, and an adequate sized rhexis of about 5.75 millimeter is done. Because the cataract is hard, we should not do a small rhexis. And now hydrodissection is done at multiple points. Small amounts of BSS is injected at multiple points. The nucleus is tapped. The nucleus is mobilized. Visco again. And now let us see. Yes, I have taken 2 hooks and I am going to bimanually rotate the nucleus. When we do bimanual rotation, stress on the joinule is minimal. Visco again, 2% HPMC, and now we are going to manage this nucleus with the Oertli machine, Oertli Catarex 3 Phacomachine. The phaco needle goes in about 1.5 millimeter is the tip length at this time. Some superficial lens matter is removed. And now watch the submarine chop technique. The tip is rotated, bevel up, and now the tip is going inside the nucleus just in front of the main wound and goes through the nucleus towards the opposite equator. While it goes, it cracks the nucleus. Along that crack, you use a small hook. This is Mohanta's chopper. This chopper is commercially available, and you just crack the nucleus into 2 heminuclei. This heminucleus is then divided into 2. Come to the other heminucleus. Every time the tip goes through the substance of the nucleus, a firm purchase is achieved and the nucleus is cracked into pieces. Now this is the piece 1 quadrant. It is, I just start eating it up. If necessary, we can divide it into pieces, smaller pieces, but this is a very leathery kind of nucleus. It doesn't usually divide. We just have to eat off from one side to the other. No small pieces are getting detached and hitting the corneal endothelium. Just look at this. Just eating off the nucleus, and the nucleus is always in the bag, and the tip of the phaco needle is at the anterior capsular rim level, and we emulsify the whole nucleus. This is done. Good. So we have managed the nucleus. some amount of visco, and the cortical cleanup is done with the help of a 23G Simcoe cannula. This is a very gentle instrument, very nice control. Chance of posterior-capsular rent is less than bimanual irrigation aspiration. Hydroimplantation is done. The lens goes in the capsular bag, and the irrigating probe dials the lens, no other instrument is required, and it is done. Little bit of visco is injected, little bit of moxifloxacin is injected, and the site port is hydrated, the corneal stroma is hydrated, and the main wound is already sealed. Thank you very much for your attention. Hope this video will help you in managing your hard cataracts.